Hello, and thank you for tuning into this short video. The purpose of this video is to address the CARES Act Provider Relief Fund. Over the weekend, there was a flurry of information disseminated through social media, and also many of you received an email from the ADA. The Provider Relief Fund was established by the CARES Act, which essentially earmarked $175 billion to hospital systems and other healthcare providers that were impacted by COVID. The original relief fund was targeted to Medicaid providers and permitted a grant equaling 2% of practice revenues for 2019. Over the weekend, it is now apparent that this program has been opened up to all dentists. I wanted to get a little bit of information out to you as we've received many communications from many clients asking about the upside and downside to applying for the relief. I want to make this clear. First of all, there is still a lot of information to be ironed out by the Department of Health and Human Services. Similar to the PPP, they've thrown this program out there and said, here's the application, we'll tell you how to spend it later. So the upside is obviously that up to 2% of your revenue would be received as a grant. Now, on initial indications, if you receive the grant, that does not mean that it will be income tax free. Based on information I have, that grant would be included in income. Let's talk about a few of the downsides. Again, this is only my personal opinion based on reading the information and the current state of the economy. Number one, any funds received will be made available to the general public. My concern there is that some of the practices could get caught up in a media storm, whether it's related to any of your actions or not. Second, similar to the PPP, I believe that many associates or team members will expect some form of benefit if you, the owning doctor, does receive the grant. This is no different than some of the feedback we received when you received the PPP funds. Some of the team members started talking about hazard pay and additional bonuses. Third, there is quarterly reporting requirements, and it does appear that it extends to the PPP and the EIDL loans. So now you will have additional reporting requirements that you did not have previously. I also believe that misuse of funds could spark an audit that may create legal fees that far exceed the actual amount of the grant. It appears that the funds are intended to be used for increased healthcare-related expenses, such as PPE and lost revenue. Now, in reading the information, some of the items that they indicate are healthcare-related expenses, it is defined very broadly. But they talk about supplies used to provide healthcare services for possible or actual COVID-19 patients, workforce training, developing and staffing emergency centers, acquiring additional resources, including facilities, equipment, supplies, staffing, and technology to preserve care delivery. So, in summary, you really need to take the time to understand the information that is currently out there. Again, there's a lot of information that has not been disseminated or even ironed out. And it specifically says in the guidance that all providers receiving Provider Relief Fund payments will be required to comply with the reporting requirements described in the terms and conditions and specified in future directions issued by the Secretary. So again, similar to the PPP, they're putting the funds out there, putting the application process out there, but they're making it very clear that they have not worked out the details. We are monitoring the situation closely and will disseminate information as we receive it. I believe that we should all be patient and allow that information to come out. If you have any questions, please feel free to reach out. We're doing our very best to monitor the situation and keep everyone updated. And one additional reminder, if you have not scheduled your mid-year tax planning session, please do so. We've included the link to my calendar and also my senior CPA, Scott Goldring's calendar. We want to make sure that everyone receives their tax planning. Thank you very much and have a great day.